Welcome to the Listen for Life podcast with Genevieve Richardson. Genevieve is a speech-language pathologist rehabilitating adults with communication challenges after a stroke or due to a neurological impairment. Get equipped with knowledge from experts in the field and professionals you need to know. We'll hear stories and experiences from others who are navigating life with aphasia. So, put your earphones in and take a walk outside. This isn't just a podcast. This is a community, a resource, and a support system. We're in this together. Do life.
Welcome to the Listen for Life Aphasia podcast. Today, I have a very special guest. Kristin Schaefer Mendez is a speech pathologist, and I'm going to let her tell you about her. But we are getting into how do we support caregivers and how do caregivers support themselves? And Kristin has a special passion for caregivers and counseling. So we're going to get into the weeds here, and hopefully you all will come away with some action steps, knowing that there are people in the speech pathology profession that are looking at your mental health, your well-being, your whole person, for you being the caregiver, as well as your person who has aphasia. Kristin, thank you for joining us today.
My pleasure. Thank you for inviting me.
Would you tell us a little bit about yourself so people understand your background and how you came to be in speech pathology and your interest in counseling?
Absolutely. Yes. So I worked professionally as a speech language pathologist for several years, and I have worked with people across the lifespan, but have really always gravitated towards working with adults with neurogenic communication disorders and partnering with families, with care partners as well. And I noticed while I was working clinically that a large proportion of the work I was doing was providing counseling and supporting patients, clients, families as they were navigating grief and loss and processing their new normal.
Yeah.
I've always been fascinated with research. I was digging into literature as a practicing clinician to find what does the evidence say and how do we as speech language pathologists provide counseling support. I wasn't finding a whole lot of information. And so that inspired my transition into research and into academia. So I was first employed as a research speech language pathologist at the University of Texas at Austin in an aphasia research and treatment lab. And from there, I pursued my PhD at UT Austin with a specialization in counseling. And so my work is inspired by my patients and families, and really my passion, my calling is to lean into the intersection of speech language pathology and counseling to support individuals holistically, both in the realm of communicating with optimized abilities as well as living well no matter their diagnosis.
I love that you said living well. That's the one thing that I've really come to understand, that when we support the whole person and the whole family, that even though there is a diagnosis of aphasia, families can live well. But sometimes it's hard
Absolutely.
for them to see the forest through the trees, right? Hard to see.
Absolutely. Absolutely. And that's really normal. And it's a normal experience for people to almost draw this line between life prior to the onset of a neurological event or a diagnosis of a neurogenic communication disorder, and then the after, living after that diagnosis, after the onset of symptoms. And what I think is so important, whether it's partnering with a patient or families or other close individuals in the client's life, is to really emphasize that this is not mutually exclusive, that you can be a person who has a diagnosis, or be supporting a person with a diagnosis. And also, you can have a host of other identities that preceded
Mm,
the onset of the precipitating event, like a stroke, for example. Those identities, being a friend, being an aunt, being an artist, that persists. And now you have this additional identity. And so you're learning how to negotiate this intersection of a variety of different identities so that in turn you can live well with aphasia, with Parkinson's, with whatever the diagnosis is, or supporting somebody with that diagnosis.
that's right. And I love how you talked about navigating these identities, as well as the intersection of adding in this new identity of having aphasia. Sometimes for someone within their first few years of having aphasia, they find that that's their only identity, and they've lost track of, or they've never mourned for some of those other identities, and they don't know how to make that transition.
Mhm. Right. And it can be really hard, for example, if some of the identities, or a person's life values, hobbies that they were engaged in have a heavy emphasis on communication, for example. And so part of what clinicians, speech language pathologists can do when partnering with patients and families with neurogenic communication disorders is to think beyond the diagnosis of aphasia, beyond the communication impairment, and working specifically on optimizing functioning in that area, but looking more broadly at a person's whole life and the different spaces that they navigate, and maybe the different activities that they used to participate in, but they're finding barriers or challenges now, and finding creative ways to think about how those spaces can be renegotiated and rework so that these individuals can continue to engage meaningfully and in spaces and activities that bring joy and meaning to their life.
Absolutely. So let's jump into a little bit of the counseling for the person with aphasia. And what are we looking for as a speech language pathologist? Because counseling in general, I remember when I was trained, we had a little bit of training in it. I'm sure in your university, you guys emphasize much more of that and how to recognize the needs of the clients that we're working with. And
Yeah.
how do we meet those kinds of needs? How do we see them? How do we know what to do about them? And how do we help?
Yes, absolutely. So, one important point I'd like to make is that speech language pathologists do have counseling within their scope of practice.
Absolutely.
And so, there are specific ways that speech language pathologists can provide counseling. And specifically, if an individual or care partners, or those
Mhm.
care partners, caregivers would benefit from counseling, there are different ways that that might look. And so, speech language pathologists can provide informational counseling, otherwise known as psychoeducation, where the individual and their close others are being provided with information surrounding the diagnosis, surrounding the the ways to support and advocate in the context of a diagnosis. So, disease related
Mhm.
education, disorder related education, and counseling provided by speech language pathologists can be personal adjustment centered counseling, or in other words, emotion centered counseling
Mhm.
that is connected with the thoughts, the feelings, the behaviors that surround the diagnosis. And so, depending on a client and a care partner and where they are in terms of processing grief, processing mourning, the new normal, speech language pathologists can be attuned to the level or type of counseling that might be appropriate. But a clinician can provide counseling across the continuum of care from the very first session when they're screening or engage in an assessment to throughout the treatment phase and to the point of discharge. And what's also important to note is that it is really normal for individuals with neurogenic communication disorders and their close others to be feeling feelings of emotional distress and a variety of different feelings, sadness, anger, shock. And so that is an area that speech language pathologists can lean into as it pertains to that communication, cognitive, or swallowing impairment. That's the full gamut
Mhm.
of the speech language pathologists, the disorders that we treat. And then for speech language pathologists, it's also important that they are being aware in the context of providing counseling if maybe the experiences of their patients or family members might extend beyond the disorders that are being treated and maybe be impacting life more broadly. And then it would be within a speech language pathologist purview to lean into that, to talk some more about what a patient or family member is experiencing and administer a screening for to see if maybe there could be some type of mood disorder, anxiety disorder, something that is at play. And this can happen. This can exist in the context of having a a neurogenic communication disorder or caring for somebody who has that diagnosis. And so it's important for speech language pathologists to be aware of, be proactive
Mhm.
if it looks like there could be another underlying coexisting mental health need at play so that a person that they're treating or others that are closely involved in the treatment paradigm that their needs are being holistically met.
Yes. So if we were to administer one of these screenings and it reveals that maybe they're at risk for depression, what would be the next
Mhm.
steps a speech pathologist might do from there?
Yes, that's a great question. And I'm actually conducting research right now looking at interprofessional collaboration between speech language pathologists and mental health professionals. And what I would recommend is that speech language pathologists get a really good grasp of the mental health professionals in their community, in their town and do some research to see if there are counselors who have a background in counseling individuals with neurological communication disorders. And if not, then speech language
Right.
pathologists can pick up the phone and call counselors and even provide, maybe offer to take a mental health professional out for a cup of coffee and provide some information, some training regarding what the provision of counseling would look like and some different adaptations that can be provided so that communication is optimized.
Absolutely. It's very challenging to find mental health professionals that have some experience, and it's a real need. It's definitely I serve lots of clients across the United States. I'm licensed in a lot of
Mm,
different states. And I've heard the woes from families that they can't find someone who knows, somebody that I am more than happy to get on the phone or if it's in my town to meet with a mental health professional and give them some ideas about aphasia and strategies to maximize communication. And if this happens, do this. If this happens, do
mhm,
this. That
yep,
was one of the reasons I really wanted to bring you on the show today and talk about counseling, because I think this is the next big evolution on how we support anybody who has a communication disorder. It's not just aphasia, it's primary progressive aphasia, it's dementia, whatever the neurologic condition is, we need to find help because mental health is just as important as any other kind of health.
Exactly, exactly. And I truly believe that. So my philosophy of providing speech language treatment is to have a counseling approach, and that counseling is the foundation for the treatment that we provide, and that building a strong therapeutic relationship with patients, with their families or other care partners, is really the crux of the work that we will do together. And so without that, we could be providing empirically based, evidence based intervention. But if there's no strong therapeutic bond, then it's arguable how beneficial, how
Mhm.
motivating that treatment will be for an individual to conduct, to carry out into their life.
I'm really glad you said that. That is one really big light bulb moment I had several years back, that
Mhm.
it didn't matter the speech pathology treatment protocol method we used if the person wasn't ready to kind of process what was happening in their life, new onset of a diagnosis, for example. It was much more difficult to get carryover of whatever that treatment method we've been using. But if we can deal and help the person and their family cope and make steps towards coping and finding that light at the end of the tunnel, finding that hope
Mhm.
and belief that they can move forward,
Mhm.
then we are far more effective as clinicians. And
Mhm.
they're going to
Absolutely.
get back to they can get back to life.
Mhm. Absolutely.
Such an
Absolutely. I completely agree. Yeah.
interesting spot.
Yeah.
Well, let's pivot a little bit and talk about caring for the caregiver, because I know that early on in my training and working with aphasia, we focus so much on the person with aphasia that often whoever their significant other is, partner, spouse, best friend, adult child. I'll just use care partner just as a generic term to kind of encompass all that. That we don't always stop and look at what are they going through. The person with aphasia may have a new identity to integrate, but
Mhm.
so does that care partner. And it's just as important to look at as the treatment for the person with aphasia.
Yeah, absolutely. Yeah. When I think about the therapeutic dynamic, I I think traditionally, if you look at the medical model, there's some type of hierarchy of the doctor or the clinician being the expert, and then the patient being on a different tier. The way that I view, and that I think a lot of others view the therapeutic alliance, the therapeutic relationship and team these days, is that there is no hierarchy. Everyone's an expert in their own right. Yes, speech language pathologists are communication experts and can diagnose and treat communication disorders. But patients with aphasia, with primary progressive aphasia or other neurogenic communication disorders, are experts in living with and navigating life with a communication disorder, and their care partners are experts in partnering with and supporting their loved one with this diagnosis. And so everybody has valuable insights to offer and bring to the table when looking at creating a plan of care that is going to have optimized therapeutic potential. And so if a clinician, if a speech language pathologist conducts a series of assessments and says, oh, there might be some challenges with auditory comprehension, for example, and word finding, for example, they could build a plan of care. They could develop goals that could directly target those areas that are challenging. But if there's no conversation with the patient, with family members, then they might be selecting goals that really are not that meaningful or valuable to a person's life, or might not really have the additional thought of, well, how is working on these areas going to then lead to functional gain outside of the walls
Hmm.
of a speech language pathology office. And so it's so important that these conversations are open, that the therapeutic process is demystified, so that everybody knows what's happening, what the expectations are, and that these valued experts, the clients, the family members or care partners, can voice, well, what following a stroke or what following this neurologic disorder onset has impacted their daily life, and what are they intrinsically motivated to pursue in the context of treatment. And so offering those insights and looking at a person's full life, so the who ICF framework is such an important reminder to walk away from the medical model and this myopic focus of, okay, a person has an impairment, let's work on targeting that impairment, and looking at the environment and factors that help or hinder communication, personal factors, coping styles, a person's motivation, readiness and willingness to change, and then activities and participation areas that add value and meaning to their life. All of those areas can be part of the therapeutic plan and woven into for treatment tasks and for goals as well. So very important that all the experts are at the table together
Mhm.
to imagine what treatment will look like.
Absolutely. Love that. And you just explained it so nicely. So how
Thank
do
you.
we care for the caregiver? What are You said you're doing some research in this area. Can you tell us a little more
Yeah.
about that and maybe some takeaways?
Yeah. So I have, over the years, I have either led support groups or I've been asked to be a guest presenter at different support groups, some for individuals with aphasia, some with care partners of individuals with aphasia or primary progressive aphasia. And I've also been involved in some research looking at these ways of providing opportunities for connection, for advocacy, for self-care as well. And so individuals who are, I know we're talking about care partners, so I'll talk mostly about that right now and today. But individuals who are providing care for someone else are at risk for facing their own negative health consequences. And this can range from caregiver feelings of caregiver burden or caregiver stress. But if this happens long term, where a care partner is feeling stressed, then this can lead to what's called third party disability. And this is a term that comes from the World Health Organization. And it refers to this negative health state that can range from physical to emotional or negative mental health state that emerges in the context of providing care. And so while it may seem counterintuitive, and I know in some of the support groups that I've led, there have been conversations surrounding this this feeling of this notion of there's not enough time. There's a scarcity
Mhm.
mindset, scarcity of time, that there's not time, that days are filled from morning to night with all of the caregiving needs. And so I hear that, I understand that. And also, it's really important for all caregivers to take a close examination of their life and find in ways to provide themselves with opportunities for self care, opportunities to feel grounded, reset. And that might be on certain days just a moment
Mhm.
just a minute or two. Maybe it's walking outside for a few minutes, or maybe it's pouring a cup of coffee and sitting and enjoying that coffee in silence for a minute or two. Or maybe it's, well, a person is winding down for the evening, playing some soft, relaxing music or lighting a candle. So, finding ways to build in these moments where one feels like their cup is being refilled. That's not a luxury. That should be a priority
Agreed.
every single day. Because if not, then we care partners, anyone who's in a helping profession as well, we run the risk of this state of burnout, or there are other terms like empathy fatigue,
Mm.
where we can actually feel the suffering of others and we can hold on to that. And that can then cause these negative health states that really require the services of a physician or a mental health professional. And so before we get to that state, we need to be thinking, we need to be rewinding the tape and really reading the landscape of our daily life and seeing where within our day can we carve out these opportunities, these moments for ourselves,
Mhm.
knowing that we need that so that we can optimize our health, so that we have the capacity to provide ongoing support to the person that we're providing care for. Because if a care partner's health is compromised, and that can have a direct negative impact on the quality of care provided by the care recipient. So there's this symbiotic relationship
There.
between the health state of the care partner and that of the person with aphasia or Parkinson's disease or whatever diagnosis.
Yeah, you said it very well. What could be some steps? You talked about the scarcity of time. I recognize this. I recognize this
Mhm.
feeling, and just having had some very candid conversations with spouses, it's really difficult for them to figure out where can they carve out time. One thing I've tried to do is have them think about what are the anchors in their day. Usually it's around food, or it's about getting up in the morning. Maybe they can get up 5 minutes earlier than their person to have that cup of coffee by the window and look at the bird feeder. It might sound trivial for someone who's not going through it, but those things are really important. I've been going out to the backyard, taking off my shoes and just putting my toes in the grass for a minute and just think of one thing that's positive, even on the most stressful or exhausting day. It does help and it adds up.
Yeah. Definitely, yeah. There's a researcher who talked about microdosing on joy.
Woo!
And so I think that can really speak to anyone who is very busy, including of course caregivers, and thinking of how can you take one moment instead of letting our life and our days be this collection of one task after another, one responsibility after another, and we have this unexamined life where we can't remember what happened in the day or that day or the day before that. How can we add some moments we're really attuned to what's happening and really aware of these moments that put a smile to our face? And so maybe it's having a chocolate, if we love chocolate, and not just popping a piece of chocolate in our mouth and moving on to our next part of the day, but really savoring that piece of chocolate, closing our eyes, sitting down for a moment and savoring that piece of chocolate. Or as you were saying, looking outside and seeing the birds, listening to the birds chirping outside. And so just being fully present, fully aware and attuned, that can be a wonderful way to reset, to have a moment for self care. In addition, I would say that becoming aware, drawing our awareness to moments when we can notice physiologically that we are feeling stressed. Maybe our heart is racing, or we feel flushed in the face, or we have a feeling, a pit in our stomach. And knowing that this is a moment where our body is trying to tell us
Yeah.
that we're not at a place of homeostasis, we're not in a grounded state. And then in those moments, using some type of strategy, some type of coping mechanism that speaks to us in that moment. And so for some, it might be mindfulness, maybe doing some type of, if you have an app, for example, like Headspace or Calm or Insight Timer, there are a variety of different practices spanning from 1 minute to probably an hour or so. And so maybe in that moment you only have a minute, and so maybe it's playing some type of mindfulness guided meditation, for example, to help bring you back to a place where you feel more grounded. Or I'm a big proponent of the self compassion movement as well. So Dr. Kristin Neff and Dr. Chris Germer are two of the leading researchers for this whole element of this whole practice of self-compassion within the context of psychology, and also it's an offset of mindfulness. But self-compassion has to do with three concepts. One is that we are drawing awareness to moments when we are noticing stress, or we're noticing this is a moment of suffering, that we are being mindful of the moment, that we're not avoiding what we are
Yeah.
noticing, that we are leaning in to that feeling, that emotion, because what we resist persists. And if we can notice what's going on, we can name, there's a concept in psychology, name it to tame it. So if we can say, this is a moment of stress, this is a moment of suffering, this is a moment of frustration, it takes away the power of that feeling and the emotional intensity that we are feeling, and helps to move us down to a place of being more calm. And then the third part of self compassion is this notion that we are not alone in this experience, that everyone feels stress, suffering, sadness, frustration at some point. The circumstances might be different, but that common feeling is a common experience of being human. And so that can really help too, because being a care partner can be an isolating experience. And so sometimes it's important to remind ourselves that we're not alone.
I love that. Those were some excellent points. And I'll definitely be looking into more of the research about self compassion. But I love that you talked about awareness. You have to recognize it first, that you have to name it to tame it. I think that is
Mhm.
really powerful, because I also think there's a bit of a fear with naming it because it might feel overwhelming. So if we can decrease that emotional attachment to something, then we can cope.
Exactly. Exactly. Yeah. Tiptoeing around these feelings might intuitively feel like that's the best way to go around it, but really empirically research will show that if we can identify and really be real with ourselves of, this is what I'm feeling right now, and this is a practice, this can take time too,
Yeah.
for us to even be able to be aware of the connection between what's happening in the present moment, or what might come up for us in a moment, maybe that harkens to past experiences or past moments. But the value is that we can know ourselves better, and then know how we can best be for ourselves as we would be for a friend. And so that's another part of self-compassion, is how would you treat a friend?
Ah,
And then think, well, then how should you treat yourself? And so often we treat our friends better than we treat ourselves, but really that's the root too of, if we're going to have the ongoing stamina to provide care for other people, then we have to treat ourselves well. We have to love ourselves. We have to find moments in our days to engage in self care, social connection, again, so that our cup is filled and so that we can continue in our caregiving role.
Love that. So that was awareness, mindfulness, and then I got stuck after name it to tame it. What was the third
And
on
sure,
self-compassion?
that common humanity, that we're not alone in our experience.
That is
Mhm.
just so powerful right there because isolation is real when it comes to a communication disorder, whether it's for the individual with a diagnosis or it's the family that's caring for them. Wow,
Yeah, and we're wired for
we
connection
are.
as humans, and so there's been research done. There's a white paper specific to stroke induced aphasia that talks about isolation and how being socially isolated, socially withdrawing from communication with others in the context of having aphasia has a host of negative health consequences, including that a person is at higher risk for having another stroke. And so there are also health repercussions and risks if a care partner is so consumed with care, being a caregiver, that they're no longer connecting with others, with friends, with family in whatever types of maybe hobbies or groups that they were previously involved in, because we're wired for connection. We need it. That's part of our humanity, is being able to be with others, connect with others. And that's where being involved in a support group as well really holds a lot of value, is that I've heard, for example, some care partners say, "Yeah, well, I'll meet up with my friend or my group of friends," but it's not the same anymore as prior to when my loved one had a stroke, for example. And when I talk about what I'm going through, they don't really understand, or a care partner might feel minimized in their experience, or just not really feel like they're able to be fully real, fully transparent about what they're going through. And so that's where, with support groups, a care partner can then be in the room either in person or virtually. There are a lot of virtual support groups as well. And be in the presence of other care partners who have a person in their life that has a neurological communication disorder. And so I would recommend that to any
Absolutely.
care partner, and to try to seek out support groups that are most aligned with their experiences. So for example, if you're caring for somebody with primary progressive aphasia, look for a PPA group versus a stroke induced aphasia care partner support group, because the resources shared, the conversations had, will just be more well aligned if you can find a group that is really specific to your experience.
Absolutely. And the beauty of telepractice, well, that's doing therapy, but Zooming, Google Meetup, I mean, FaceTime or whatever it's called on an Android phone, we have the technology now. And so we don't have to, if we have something like a smartphone or a laptop, we can get on with a group. We can connect with other people like never before. Before the pandemic, many folks, older generation, never really did any of this, but
Yeah,
so many people were forced to learn it. And now it's a
right.
tool. The National Aphasia Association has a ton of support groups and
Mhm.
interaction groups for the person, for the caregiver, aphasia recovery connection. I'm blanking. Yes, that's
AFTD,
what
Association for Frontotemporal
that's
Dementia.
right.
Mhm.
Any other
Yes.
ones you can think of off the top of your head? Oh, virtual connections through Lingraphica.
Yes.
Lots of
Yes.
wonderful groups.
Yes, and even for care partners or people with aphasia or other neurological communication disorders, just looking in your community and finding the local university or universities and seeing if they have a support group. Sometimes they could be virtual, sometimes they could be in person, and sometimes they can be hybrid. And so looking to see within your community what might be offered is also a great way to get connected.
Wonderful. Kristin, I want to thank you for sharing your experience and your knowledge and your passion for caring for not only the people with aphasia or a neurologic communication disorder, but also for their families, because it is about the
My
whole person.
It is. It is. My pleasure. It's been an honor to chat with you today.
Thank you.
Thanks for tuning in to the Listen for Life podcast. We hope you feel empowered and supported. Head over to listenforlifepodcast.com to see the show notes with links and information from today's episode. Do you have a topic, a resource to share, or a guest recommendation? Inquiring minds want to know. Let us know in the comments section. Wishing you a fabulous week.